There's a patient at Crash Bank. Can you come and have a look, please?
Yeah, sure.
At the Gold Coast Emergency Hospital,
Check his chest.
8-month-old Billy has been rushed in after being run over by a bicycle.
Oh!
Yeah.
Okay, Billy's in trouble. The biggest concern we have is that Billy's gums are almost white. So she's potentially bled somewhere, and if she has bled, she's bled a lot.
Wait, she's got some swelling.
Given pain relief, given part of it IV, part of it subcutaneously. Hey team.
The young dog is in extreme shock and needs an urgent blood transfusion.
What's the heart rate, Gerardo?
140. And what's her pulses feel like, team? Yeah, her pulses are very weak. Oh, Billy. That's all right. You get oxygen helps. Oxygen helps. You need some oxygen. You stay there, hey? So Billy's pale. We're stabilising her with fluids. So we're just going to do a little ultrasound and
See what's in there.
get a little sample. Hey?
Okay.
Just got to find a pocket of fluid. Whoa. Settle.
An ultrasound will tell Gerardo if Billy has internal bleeding.
Okay. And your little sample now, sweetie. Good girl.
Good girl.
Oh, wow. Okay.
The news isn't good.
Blood.
Lots of blood.
Cool. Run. Thank you. My biggest concern here is that she's bled into the abdomen. The thing is though, there's so much blood in here. The colour is terrible. So we confirmed. So we did an ultrasound and we collected a small amount of fluid and confirmed that it is blood. So she has bled inside. I don't know where the bleeds come from. It could be from her spleen, could be from her liver, could be just from a blood vessel, we don't know. But that's not the important thing. The important thing is she needs blood transfusion. I'm super worried. She's a sweet dog and her parents love her so much. And I think that there's a high possibility that Billy may not make it.
It's a busy morning at Kate's Bondi Veterinary Hospital.
Morning.
And it's about to get even busier.
Excuse me, hi. My dog's just been bitten by another dog.
Oh no, okay, let me go get Dr. Kate.
Foster carer Elise has rushed in with 7-year-old Whacka, who has a nasty injury.
Hello, Elise.
Hi,
How
hello.
are you? Oh dear.
So he's bit him over this side.
Dear. Oh, I know.
And
It's
just
sore.
scratched
So
his
shaken
eye
up.
as well.
You all right, buddy?
Elise comes in, she's totally stressed. Whacka's been attacked by another dog up the road. They've had a little bit of an interaction. It seemed kind of friendly. Come on, buddy. And then all of a sudden, boom. And this other dog has grabbed Whacka and just completely ripped his skin on the side of his shoulder.
It all just happened really quickly. They were going at it for maybe 10, 15 seconds. It was just terrifying. I was just yelling, get him off, get him off. My heart was racing.
This isn't good, Elise. Got him well, didn't it?
Yeah.
Okay.
Yeah, it was really scary.
This wound is really open. It's bleeding. I can see that there's a hole straight through that muscle layer.
This is going to need stitches. This is the problem with dog bites. Quite often they're a lot more serious than what they actually look like on the outside. You must be in a lot of pain, buddy.
If we leave this like it is, it's just going to get infected and it's going to be an absolute mess.
He's not castrated, is he?
No, and the other dog wasn't as well.
Right, okay.
Generally, when you get 2 adult male non-castrated dogs, it sometimes can be a recipe for disaster. The other dog would have seen him as a threat,
Yeah.
even though he's such a beautiful dog. I think it's a reasonable suggestion to castrate him at the same time. He's under anaesthetic. Elise was going to do it at some point anyway, so we may as well do it today. It's a big day, kid. You're all going to be okay.
Right. You get in first, big fella.
All right. At the Australian Reptile Park, trouble's brewing in the alligator lagoon.
Righto, got a couple of paddles.
Yep, good to go.
Where'd you last see him?
Mate, he was actually closer to the ramp, so we should probably head straight out there, I'd say.
Dan's called me down to the gator lagoon, and what he's seen is one of our gators, it's named Gary, picking on everyone else. All right, so that's Gary, hey, right in the centre.
Right in the centre, up on the bank there.
First course of action is to go for a paddle around, see if we can see any gators with injuries, have a look at Gary, have a look at the other males, and just really get an understanding of what's happening. Have a look at him.
He's definitely top gator now, I'd say.
The lagoon is home to more than 40 alligators. Things can turn ugly when the show-off males fight for attention from the females.
Oh, Gary! A female moves a millimetre too close, bang, Gary's onto her. That's a real telltale sign that the pond is sensitive. It's a recipe for disaster. Where's Brutus?
Brutus is actually behind us. He's hiding.
Cowering in the corner.
Yeah, he's been doing that the last 2 weeks, I'd say. He doesn't want to go anywhere near Big Gary.
He's a shadow of himself.
I know. Usually he's always around the girls. Not anymore.
Look, here's Googly. Whoa!
Whoa! You don't really see those two boys hide like that, particularly Brutus.
Yeah, you've got a problem. They're hypersensitive. We just went near Mr. Googly. He has googly eyes, that's his name. And he straight away takes off. He's really highly strung. It's really obvious that Gary is giving everyone a hard time.
Let's go, mate, let's go.
I don't want him to pop up near us, mate.
No.
If he's hot, he's going to come at us.
You need to start
Here he
paddling,
is.
mate. Start paddling.
He's only 3 metres away. He turns, he's underwater, but that's not the end of it. He pops up and he's going to attack the boat. Oh! That was an attack. Gary's got to go, or the other 39 gators. The decision's pretty simple.
Gosh, he's such a good boy.
In Bondi, Kate's prepping greyhound Whacka, who's just been injured in a violent attack from another dog.
You're okay. We're just going to put a little catheter in. It's going to be fine. You're going to be fine. I don't think he's the bravest greyhound in the world.
Whacka's bloods are all completely normal. That's really relieving because it means we're okay to start a general anaesthetic. Yep.
Kate is going to clean out and stitch Whacka's deep leg wound. Safely anaesthetising the big, gentle greyhound is risky.
Greyhounds are definitely more sensitive to a lot of drugs than other breeds of dog. And that's because they don't have much body fat and things can go pear-shaped very quickly.
Look at this. Isn't this terrible?
Yeah.
Look how deep that is.
Oh, yeah.
It literally goes through all the way down. It's terrible. No wonder it hurt.
Kate's first priority is to thoroughly flush the wound.
We're just flushing it here with saline and it's important that we use quite a lot. I mean, I know it looks like we're really going to town on this, but if you don't clean these properly, they get post-op infections and it's a complete disaster.
One of the biggest dangers from dog bites is the spread of bacteria, which can lead to serious infection.
So all of this tissue here is actually quite dead. There's now bleeding at the edge of this wound, which is what we want. And the bleeding at the edge of the wound means that there's really good blood supply in that tissue. The worst thing that you can do is stitch up 2 pieces of skin that have no blood supply. Yeah, so we can see down here that it runs quite deep down under this tissue. So we've got a wound that's essentially around about 3 centimetres deep down into that muscle layer. Greyhound skin, while it's fragile, is actually quite nice to stitch up. We've done the first part of the job.
The second part of Whacka's surgery is castration. This will eliminate the possibility of testicular cancer and reduce the chance of prostate disease.
You know, greyhounds are sight hounds. They need really special anaesthetic protocols, so we just need to make sure we monitor everything from temperature to heart rate pretty carefully.
It's pretty good, love. That's good.
Job's finished, it's time to bring him back around.
1, 2, 3.
Things have gone really well for Whacka. He's going to be fine. I'm the eternal optimist. As long as he doesn't get to these stitches, you're not allowed to chew at them, buddy.
I'm back.
You all right? Hello. He's just in recovery at the moment. He's going to be pretty whacked for about 3 hours or so. You're a good dog.
Oh, there he goes. Oh,
Oh, Gary.
let's go, mate. Let's go.
I don't want him to pop up near us, mate.
No, no.
If he's hot, he's going to come at us.
At the Australian Reptile Park,
Now let's get out of here, mate. There he
Paddling,
is.
mate.
Oh! That was an attack.
Tim's decided troublemaker Gary has to be evicted from the alligator lagoon.
Woo! That was hairy.
He's big.
He's big.
But wrangling the feisty 400-kilo monster is going to be extremely dangerous.
You watching that gator?
Yep, gator on the right. There's some risk involved for us as keepers, but we've got a pond a couple of 100 metres away, a cooling off pond, so we can put Gary in there, let him settle for a few months, see out the breeding season, let the other gators settle and put him back in. It's dangerous, for us mostly, don't go in his mouth. It's that simple.
Before they can attempt to tackle Gary, Tim and his team have to separate him from all the other gators.
Dan, you want to have a look for Gary and see if you can spot him?
Yeah, I'll try and feed him, bring him up.
All right, let's do it. The gators are all up on this bank because they're sunning. Some of them don't want to go back in the water, and that's challenging, but they have to, otherwise it's too unsafe for us to catch Gary. Look at that.
All right, girl, come on, up.
1, 2.
Hey, look here, Zach. We had a bite on Princess right there on this side. Superficial, but still, that's Gary for sure.
Guys, I've got him over here. He's actually right at the ramp.
Dan's found Gary. Zach, Giffo and Lizzie have moved all of the gators from the bank into the water. The reason we do that is because we've got to try and lure Gary up with food. When Gary's mouth's open, I slot that over his head, it grabs his head and it pulls. You've got your gator. Let's hope it's that easy.
Come on. Come on. Gary, come on. Come on. Come on.
Suddenly, Gary's cornered and is about to get his marching orders.
Now, when you're used to working with saltwater crocodiles, they're explosive. I saw that today in our big gator. He launched at me. He got really, really close to the point where my heart went up through the roof.
Oh! Good lunge.
Come on. Oh, right, get ready, guys. He's on. Come on.
Keep him.
Oh, he's got the food.
Gary tries to make a run for it,
Yep.
but Tim's too quick.
We got him.
Whoa. Get on that rope,
Everyone on. Righto. Just Dan, let's pull it this way, guys, so it's solid. Yep. We're gonna have to get on him quick, smart. Get that from around his neck. Further. 1, 2, 3. 1, 2, 3. Okay, Zach, you peel off the gators.
Go.
Righto. I love times like this. Team just gets in and get the job done. Don't matter whether a tree falls down or we've got a busy day with visitors or catching Gary. The team just comes together and I love it. 1, 2, 3. Well done.
All good. A good jump, Giffo.
Now for the most dangerous part, keeping Gary still so those deadly jaws can be taped shut.
Right, we'll put a couple more. Not over the nostrils.
Yeah, good.
Righto, take a breath, everyone.
Good work, mate. That was good.
That's good. Wasn't easy.
Geez, those lunges.
Yep. Watch that mouth, mate.
On the Gold Coast, Gerardo is desperately trying to save 8-month-old Billy, who has severe internal bleeding after being hit by a bicycle.
It's blood. So, we're getting things ready. We're going to go into ultrasound and we're going to harvest some of her own blood in there and give that back to her. That blood that's in there is the safest blood to give, and give it quickly as well because there's going to be no reactions. Maybe get clipping. Yeah, let's go just a little bit further. It'd be good for me. Don't jump, hey. Okay. Let's check her kidney. Okay. Kidney looks nice and normal. And now we're coming over to spleen. That looks like it, doesn't it? I think think I found where the bleed's coming from, and it's not a good place.
So where are we off to today? We are off to see a new client.
Alison and vet nurse Amber are on the move in Brisbane.
You want to have a cuddle? Hi.
I got Charlie 6 years ago from a animal rescue shelter.
Ooh, get the spot. Oh, how nice is that?
Owner Montana is devoted to her special girl, Charlie.
She means a lot to me. She's a very calm cat. It's an extension of me.
Hi. How are you?
I'm good, thanks. How are you?
Good, thank you. This is Amber, our vet nurse.
Hi, lovely to meet you.
Hi, Charlie.
So with Charlie, a couple of little things that have been happening here and there, and I'm starting to get a bit worried that they're all connected and something more is going on with her. You'll probably be able to see some of her dandruff and some flakiness in her.
Yeah, she's shedding quite a bit. Even when I stroke her, there's quite a bit of
The shedding is a worry, but then the concerning thing was that when she goes to the litter and goes to the toilet, there is a little bit of blood sometimes in her stools.
Oh, wow. And is the blood red or is it brown colour?
It's red.
It's a red, okay. Blood in a cat's poo is just not normal, so this could be something very serious. All right, well, we might pop her into the van, have a better look, and just give her a good check over and see if we can get to the bottom of it. That is a worry.
It's all clean. Excellent, buddy. It's looking good. It's looking good. You've been a very brave dog today.
3 hours later in Bondi, greyhound Whacka has recovered after surgery.
Come on, let's go. Let's go see your mum.
And he's ready to go home with foster mum Elise.
Yeah, I'm so excited to see Whacka. My favourite thing is coming home from work and he's waiting at the front door and he'll jump up to me and say hello, and yeah, it's the best part of my day.
I know. It's your mum out here. Let's go find her.
It's been really quiet without him. I've been really anxious waiting for him to come down after surgery. I know, you think you're so intense.
I'm a little bit groggy.
Hi,
I'm
Whacka.
a little bit groggy. He doesn't know what's going on. I love Whacka. He's such a good boy. And honestly, if I had the space in my house for another dog, I would definitely get a rescue greyhound. Just in case.
Yes. Okay, thank you so much. All right, Whacka, you ready to go?
You're off, kid. See you later, alligator.
We're going to go home. This
Oops,
way?
This is the wrong way, buddy.
That's the wrong way.
It's the wrong way. Come on, just turn around this way. You go around this way? Come on, let's go
Whacka.
around this way.
This
There
way?
we go.
Yeah. Here we
See
go.
you, Elise.
Bye. Thank you.
Nero. Yeah, see how he's doing.
In Sydney, Alison's twin sister Audrey is also making a house call to check on an unwell cat.
Off to see our little man. I know, I'm excited to see you.
Audrey and vet nurse Bree are in for a treat today. 17-year-old Nero, a talking cat who lives with his devoted owner Simone.
Nero. Hey. I told you it's your day. I know. I'm an animal communicator. I do animal communication for clients. I also teach it for beginners, and all the students have fallen in love with him, and he tells them, I go, don't tell them our secrets. And sometimes he does, and they love it. So what have I always said? We welcome people into our home, don't we? Thank you. Thank you. Nero chats to me all the time, tells me what's going on in his world. I tell him how my day's been. I've got to go out. Where's my food? Come and feed me. Some people think I'm strange until they know that I do animal communication. They go, oh, that's what it is. But they'll, yeah, a little bit crazy.
Hi, Simone.
Hi, Audrey. Hi, Bree. Nero's waiting for you too.
Is he?
Yeah.
Audrey has regularly been monitoring Nero, keeping check on his kidney disease and high blood pressure.
So how's he going with his arthritis?
He's going okay. He still has trouble walking a little bit, getting up and down. His arthritis really affects his personality. If we can't manage it. He's like a different cat. He's depressed, he's sad, he doesn't want to interact.
Okay, shall we get you on the table?
Okay, I'll put him on there
Yeah,
for you.
wonderful. Let's get started. So Nero is an interesting patient. He's one of my older patients with a lot going on. Like, what isn't going on with him? He's got a heart murmur, he's got kidney disease, he's got high blood pressure, and a really sore back. So I presume you've told him what I'm going to do to him today?
I have.
So I'm going to take some blood from his jugular and we're going to send that off to the lab. So we're just checking his kidney parameters. So I will compare that with last time and just see where that's sitting. And then also the blood pressure, which he doesn't like too much, but it's not painful. Just want to get a reading and hopefully that's back down to normal levels as well.
Whatever.
Is he saying whatever to me?
Whatever. It's kind of like you're getting the paw.
I'm getting the paw. Mum is seeing a paw right now.
Tim Doyle, radio holders. Reptile crew, Liz and myself are out at Gators and we've caught Gary. He's got to go up to the cooling off pond. So can we have as many bodies as possible, please, to help carry him?
At the Australian Reptile Park, Tim needs reinforcements to help move a cranky 400-kilo alligator that's been causing trouble.
Come on in, gang. This is about half the park. The rest are doing what they have to, but this is half of us, and it may not be enough. Righto. Ready?
Yep.
Okay, up we go. It's a gift, try and get in. We might even be able to go on the shoulder, mate, because you and I are little lads. We need more up the front.
Yeah, more up here. Yep.
Bully boy Gary has been moved 200 metres away to a smaller separate pond, away from his rival gators.
Gary's real heavy, but it's that classical example of many hands make light work, and this is when a team comes together.
All right. Yep.
Right, Chip?
Have a breather.
Yep, breather.
Wait on.
Yep, get on in, Cam. 2 knees over, someone behind Cam. We're almost there now. Dan and I have just come to have a bit of a look at the pond, make sure it's okay. That's good, mate. Yep, that's the cooling off pond, the naughty corner. And the team is just 20 metres that way, but it's hurting.
Okay, 1, 2, 3.
Ooh-wee.
All right, guys, this is it.
Righto, the last charge.
Hold on, building. Building.
Hang on, we're all good.
We're good.
Got him?
Just reset.
We've got one last big step to get over.
Big step.
Okay, turn, step. You know, we talk everyone through. Right, it's up to you, it's up to you, it's up to you.
Okay.
We made it. Adsy, you can jump off. Kane, you're right. Off you go.
Yeah, you're good.
Hewan on 3. Hewan, on 1, Zach will let go of the jaws. On 3, you jump straight backwards, mate. Okay, 1, 2, 3. Well done, mate.
At first, Gary is not too sure about the new digs.
Come on, mate. Come on. Here he goes.
But with a bit of encouragement, he's decided solitary confinement isn't so bad after all.
Woohoo! Well done, all. Big effort, thank you. Gary's in the naughty corner. The team really rallied together when needed. Hopefully, this will cool him off.
Thank you.
Hey Charlie, welcome.
In Brisbane, little rescue cat Charlie hasn't been herself, and Alison is keen to find out what's wrong after discovering blood in her faeces.
Hey, oh, it's all a bit new. So Charlie looks actually quite bright and happy. She's a young, active cat, and she looks quite healthy on the onset. How old is she now?
6. She was 7 in March.
My goodness. Look at how much she's shedding at the moment, isn't it? I know she's a bit stressed, but that's quite a lot. When we take a closer look at her coat, it's just not a healthy looking skin. Yeah, that fur is quite flaky. The good thing about her being black is you can actually see it just come up when you're...
top, yeah.
There's no cuts or pus or anything like that. It's just literally quite dry.
Very dry.
Can often be a sign of a deficiency in the diet.
Yeah.
Now she's up to date, you said, with all her flea, tick and worming prevention, which is good. So we know that's all covered, which is great. Flaky skin and shedding more than usual is a definite sign that something's not quite right. But I'm not going to rule anything out until we get a sense of what's happening internally. Let's have a feel of that tummy.
Yes, sweetie.
So tummy's nice and soft. She's not particularly upset besides just it being quite a funny position to be in. Obviously it's a little bit uncomfortable, but she's not in pain. And her bowels actually feel soft and empty, so that's good. So I'm presuming she has done a poo in the last 24 hours?
Yes.
Okay. Good news is Charlie is not constipated, but bleeding from the bottom is definitely not normal. So I do need to get a bit more information.
I actually have a sample here.
Oh, perfect. Montana actually has collected a sample of Charlie's poo, which he's kept nicely for me in the fridge. Just got the cat litter in there as well, but you see how it's quite sort of nuggety-like, almost like little small stones. That could explain why it's actually traumatizing Charlie's bowel on the way out. It's causing a bit of ulceration, and that's where that fresh blood is coming from.
All right, Charlie, let's pop you away. Hey?
I think she'll
Thank you for being so good. Hey, get you back up. Pop you in the carrier, safe and sound, and I'll just have a chat to Mum.
So at this point with Charlie's skin and her poo, it's looking that this might be all related to actually her diet. She's actually quite happy and bright, she's eating, she's her normal happy self, but just her bowel movements and her skin just aren't 100% healthy.
Okay, let's see how you like your new food.
You don't chop and change a pet's diet straight away, that we slowly introduce the new food and reduce the old food because the gut can be quite sensitive to drastic changes.
Oh. There you go. What do you think?
There's definitely no objections here.
What I'm hoping with this diet is that Charlie's going to feel a lot more comfortable going to the toilet, that she's not going to have any more of that fresh blood that we are thinking is coming from the poo being too hard, and also that she regains that health to her coat.
It also comes in a wet food, which is great. So we'll see if you like this too, Charlie. Well, come try your food. There you go.
It was good to know that it was just an easy change of diet is going to definitely help her. I'm really excited to see what's going to happen, so fingers crossed it all goes great.
I think I found where the bleed's coming from. There is a big blood clot up near her right liver.
On the Gold Coast, Gerardo is still desperately trying to save 8-month-old Billy. The young Kelpie has severe internal bleeding after being hit by a bike.
What we're going to do is place a catheter into Billy's abdomen. Then we're going to harvest the blood. It's going to go through into a collection bag and then into a filter and then straight back into Billy's vein. So that's her own blood, so it means there should be no reactions at all. Right down the back here, team.
Gerardo has located a spot where he'll be able to insert a catheter, but it's precariously close to Billy's spleen.
I'm going to be careful not to lacerate it because that will cause catastrophic bleeding. So that's a spleen just there, and that's our catheter. Now we're harvesting all that blood. We've got the catheter in now, and within seconds we've collected already about 50 mils of Billy's blood. And we're about to put that straight back into her vein. And what blood type is she?
She's positive.
DA 101.
Oh, no, 1.1 positive, yeah.
Okay. We've removed 400 mils of blood, and it looks like as if there's at least twice that much volume still in there. So we're going to keep on harvesting and start giving it back to her. So before, we had organs floating around in blood, but now there's significantly less.
So I'm going to take some blood from his jugular and we're going to send that off to the lab. So we're just checking his kidney parameters.
In Sydney, Audrey's patient is 17-year-old Nero, who's been having ongoing back pain.
Some cats will sometimes twitch when I feel around here, and that can be because of the arthritis. And we'll see what we can do about that. How's that sound?
When he's feeling better, Nero is constantly talking to devoted owner Simone.
I am on call 24/7. It's like having my mobile number on as his hotline. Doesn't even matter. It doesn't matter if I'm on a call. He can break that call stop it and make me talk to him.
Get started.
He's not very chatty today, but it turns out Nero's got quite a soft spot for Audrey.
Audrey's energy is really approachable, but not only is her energy approachable, Audrey's energy is grounded. And she holds the space for him, so that entices his trust. If you can get his trust, he'll nearly let you do anything to him. It's all right.
Let's get your little blood pressure cuff ready.
Lately, Nero's blood pressure has been on the high side, which could lead to organ damage if not kept under control.
So we've taken the blood from Nero and we've taken his blood pressure, and I'm really happy because his blood pressure's back down to normal. Sitting at 120.
Is that good?
120 is pretty good.
Oh, thank God.
So he was up to the 200s, which is pretty dangerous.
Yeah, I know, so worried.
Yeah, that high blood pressure can cause a lot of damage to the kidney itself, but also to every other organ that the blood runs through.
Yeah.
So that's one tick. The next thing is going to look at his arthritis. Shall we have a look at him walking? Well, yeah, he does look really sore, just the way he's moving those back legs.
Okay, yeah.
So arthritis is pretty painful for a cat because if it happens in that lower spine joint, it really makes it immobile. It's crunchy, they lose their cartilage and their lubrication, so it's really sore every time he moves to walk, to groom himself. I'm keen to make him more comfortable. We have to bear in mind that he has got a few other things going on, the kidney, the heart, the blood pressure. So I'm thinking of a supplement that you can add into his food, and it's going to provide him some comfort. It's actually made out of green-lipped mussels, and it's got all those omega-3s, which are good for inflammation and pain. It's got chondroitin in it, which is really good for cartilage health. So all of those things will help, and it won't affect his other problems.
Fantastic.
So I've got some osteo support, which I love. Comes in a capsule, but it's got a powder inside. With the capsule, we're gonna break it open and actually sprinkle it on top of his favorite meal. So in Nero's case, that's chicken.
Oh my God, if he eats that, I'm gonna be over the moon. Oh my God.
So that's really great. That's exactly what we wanted. He loves it, just once a day into his food, and I think you're gonna see a huge improvement.
Fantastic.
So I'm hoping that in 4 weeks' time, Nero will start to feel a lot more comfortable. He continues to eat the supplement, which is good for him, and we get all his other problems under control. All right, see you.
See you next time. Bye. You're gonna wave goodbye? Bye. See you later, Audrey. See you later, Bree. Bye.
She was as white as she could get and still be alive. You miss.
Yeah, she looked like a ghost.
On the Gold Coast, Gerardo has started Billy's blood transfusion and is using the Kelpie's own blood to save her life after being hit by a bicycle.
And fingers crossed, it makes a big difference pretty quick. Good girl, Billy, good girl, Billy. Right. Good girl. Oh, hello, Billy. Oh, what are you doing? You're stretching. Are you stretching? You were stretching. So, Billy is looking around and she's even stretched a couple of times, and she's so sweet. Means that the blood is making a difference already. So we're only halfway through giving the blood we've harvested. I want to go tell her mum and dad the good news because they need some good news, because when they brought her down, they thought she was going to die. Come on through. Hey Kirsten, this is Billy's mum and dad.
Hello. Hey, look who's here.
Hey girl. How are you, girl? Looks a lot better. She was wagging her tail and scratching before. She's just having that bit of skin grass. Yeah.
Thank you. Good girl. Hello. I'm feeling good.
It's definitely a lot more responsive. She's like 100% better, almost. Not quite back to normal, but she's...
Oh, that's good.
So the plan now is we're going to monitor closely and monitor for any kind of further bleeds into their abdomen.
Yep.
We're going to give Billy some medications which help stabilise clots. So hopefully that clot that's there stays there, and then we just wait.
Okay.
She has about 1.5 litres of blood in her, okay? I think there's probably about 900 mils in her abdomen, and she was like this close to not making it. But we've pulled out about 700 mils, and we've given it all back to her.
Yeah.
And yeah, massive difference.
Right.
So we just got to pray that that clot stays there. Okay, you can spend some more time.
Look at you.
Just 12 hours later, Billy is continuing to astound Gerardo with her remarkable recovery.
Hey, little Billy. Oh, looks so much better. Good morning. How was your night? Let's have a little look. Let's have a little look. Okay, there you go. You can finish it off. And then we have a look at your gums. Good. And one more. Nice and pink. Hey, aren't you a good girl? It's so awesome to see Billy this morning. She's bright, she's eating, and the nurses say that she's walking around. We don't want her too active because there's still a clot there that may dislodge, but she's definitely heading in the right direction. And if she continues along this way, 24, 48 hours, she'll be right to go home.
Whacka, come on this way. Come on. Come on.
Elise has come back to the Bondi Veterinary Hospital with rescue greyhound Whacka.
So we're just going to see Dr. Kate today and check up on the site to see how it's healing. We were a little bit worried because he's scraped away a little bit of the scab, so it would be good to see what she thinks.
The 7-year-old needed stitches from a nasty bite wound from another dog.
Come on, let's have a look. Let's have a look at this wound. Whacka's here just to have a quick check. We need to check those sutures. If they're looking good, take them out and get Whacka on his way.
All right.
Let's get these PJs off.
We'll do the back legs first.
This is actually his pyjamas.
Yeah.
Does he have like a day suit as well?
No, he doesn't. We
Just pyjamas.
It's been pretty tough trying to keep him away from those stitches. I think it itches him a little bit. So we try and keep his jammies on to stop him to scratch those stitches open.
Oh God, this is actually really hard.
It's easier when you've got the one leg off.
Okay.
Whacka's cosy onesie is proving a bit of a challenge for Kate.
There it goes.
Ready for it.
Oh, so it's a little bit open here, Elise.
Yeah.
So I can see, and I actually don't think this is necessarily Whacka's fault. I think that this stitch here has actually busted open because it's been a little bit infected. It's not uncommon with mouths.
Okay.
Obviously when they have a bite, there's lots of bacteria in the mouth.
Yeah.
So the fact that we've just got this tiny little bit here, the rest of the wound is beautiful. So
Whacka will be feeling a lot more comfortable once Kate removes his stitches.
it's not a major problem. I see these all the time. This is going to be okay. We just need to keep Whacka on antibiotics for a little bit longer. This won't be too uncomfortable, but we're going to take these out. They're not.
Are you going to take all of them out?
I'm going to take all of them out. These stitches aren't doing anything anymore. The ones on the top, it's broken down. We need to take them out. And the ones on the bottom, they look perfect. So take them out. Yeah, I'll just get under there like a car. Stitches are out, the shoulder looks great. There's one other area to check, and that is where we did the castrate. I think of greyhounds and lots of big dogs like a car. Just get right under them. So I'm quite happy with this. It's just a little bit of bruising. It's common after surgery, so don't stress about that.
Okay.
All in all, this has gone really well. Should be really happy. This is the perfect result.
Okay, great.
This is as best as you can possibly hope for.
All right, thanks so much.
See you, buddy.
Whacka.
See ya. Whacka looks great. He's happy, he's friendly, he's just such a beautiful dog, and he looks amazing in that onesie.
All right, Whacka, come on this way. Come on.
Grumpy Gary has been on his best behaviour, and Tim is confident he'll soon be able to go back to his mates in the alligator lagoon. 2 weeks after treatment, Kate's patient Whacka has fully recovered from that nasty bite and is back enjoying daily walks. As for talking cat Nero, he's moving a lot more freely. Owner Simone reports he's a lot happier.
He can jump up and down the bed, sofa, and he's got quality again. As long as he's got quality and he wants to be here, I'm happy.